Ladies and gentlemen, welcome to today's lecture on the fascinating topic of Moebius syndrome, insights into its neurological foundations and clinical management. In this lecture, we will explore the intricate anatomy and physiology of the cranial nerves, focusing on the facial nerve pathway and the dysfunction associated with Moebius syndrome. We will delve into the neurodevelopmental origins of this condition and discuss the neural circuits involved in facial expression. Furthermore, we will investigate the role of neuroimaging in understanding Moebius syndrome and examine the mechanisms of neuroplasticity and recovery in these patients. Additionally, we will discuss the genetic mutations associated with Moebius syndrome and highlight the significance of speech and language assessment in evaluating individuals with this condition. The lecture will also shed light on the different surgical interventions available for facial reanimation in Moebius syndrome, as well as the psychological and cognitive profiles of individuals affected by this syndrome. Furthermore, we will emphasize the importance of a multidisciplinary approach in the management of Moebius syndrome, considering the contributions of various medical specialties in providing comprehensive care. Lastly, we will touch upon future research directions in the field of Moebius syndrome to encourage advancements and improvements in diagnosis, treatment, and support systems. Now that we have outlined the topics we will cover, let us embark on this journey into the intricate world of Moebius syndrome. The cranial nerves are a vital component of our nervous system, responsible for controlling various functions of the head and neck. They originate from the brainstem and play a crucial role in facial expression, speech, swallowing, and sensory perception. Understanding the intricate anatomy and physiology of the cranial nerves provides a foundation for comprehending the pathophysiology of Moebius syndrome. The facial nerve, also known as cranial nerve 7, is of particular interest in the context of Moebius syndrome. It originates within the brainstem and travels through several structures before innervating the muscles responsible for facial expression. Dysfunction of the facial nerve can lead to a range of symptoms, such as facial weakness or paralysis, impairing the ability to smile, blink, or make other facial movements. We will explore the underlying causes and clinical manifestations of facial nerve dysfunction in Moebius syndrome. Moebius syndrome is a complex neurodevelopmental disorder that manifests at birth. It is characterized by the absence or underdevelopment of specific cranial nerves, particularly the facial and abducens nerves. The lecture will delve into the embryological origins and genetic factors that contribute to the development of Moebius syndrome, shedding light on its pathogenesis. Facial expression is a fundamental means of nonverbal communication and emotion conveyance. This topic will explore the intricate neural circuits involved in facial expression, emphasizing the role of the basal ganglia, thalamus, and other brain regions. We will discuss how alterations in these neural circuits contribute to the facial dysfunction observed in individuals with Moebius syndrome. In recent years, neuroimaging techniques such as magnetic resonance imaging, MRI, have revolutionized our understanding of neurological disorders. This section will explore the application of neuroimaging in Moebius syndrome research, highlighting the insights gained into the structural and functional abnormalities associated with this condition. We will delve into specific imaging modalities and their significance in diagnosing and monitoring the progression of Moebius syndrome. Despite the inherent challenges presented by Moebius syndrome, the brain exhibits remarkable plasticity and potential for recovery. This segment will explore the various neural mechanisms underlying recovery and compensation in individuals with Moebius syndrome. We will discuss the role of neurorehabilitation techniques and highlight how neuroplasticity contributes to functional improvements in facial expression and other associated functions. Moebius syndrome has a genetic basis, with several key gene mutations identified as potential causative factors. In this section, we will explore the specific genetic mutations associated with Moebius syndrome, focusing on their impact on cranial nerve development and function. A comprehensive understanding of these genetic variations provides insights into potential targets for future therapeutic interventions. Individuals with Moebius syndrome often experience difficulties with speech and language. This topic will delve into the specific challenges faced by this population, such as articulation disorders and expressive language delays. We will discuss comprehensive assessment approaches used by speech-language pathologists to evaluate and address these challenges, outlining evidence-based interventions and techniques that promote effective communication. Facial reanimation surgery plays a crucial role in restoring facial function and improving quality of life in individuals with Moebius syndrome. This section will provide detailed insights into the various surgical techniques utilized for facial reanimation, including muscle transfers, nerve grafting, and botulinum toxin injections. We will explore the indications, outcomes, and potential complications associated with these interventions. Beyond the physical manifestations, Moebius syndrome can impact psychological well-being and cognitive functioning. This topic will delve into the psychological and cognitive profiles of individuals affected by Moebius syndrome, discussing the challenges they face in areas such as social interaction, self-esteem, and academic achievement. We will also explore various psychological interventions aimed at supporting and empowering individuals with Moebius syndrome. Given the complexity of Mobius syndrome, multidisciplinary collaboration is essential in providing comprehensive care to affected individuals. This segment will highlight the various medical specialties involved in the management of Mobius syndrome, including neurology, otolaryngology, genetics, speech-language pathology, psychology, and rehabilitation medicine. We will discuss the importance of a holistic approach and effective communication among the healthcare team to optimize patient outcomes. As we conclude this comprehensive lecture, we will explore the exciting avenues of future research in Mobius syndrome. Despite significant progress in our understanding and management of this condition, many questions remain unanswered. By highlighting potential research directions, we hope to inspire scientific advancements that will further enhance diagnosis, treatment, and support systems for individuals affected by Mobius syndrome. In this extensive lecture, we have navigated the intricate world of Mobius syndrome, exploring its anatomical and physiological foundations, clinical manifestations, and multidisciplinary management. We have learned about the neural circuits involved in facial expression and the genetic mutations associated with this condition. Furthermore, we have explored the role of neuroimaging, neuroplasticity, and neurorehabilitation techniques in understanding and improving the outcomes of individuals with Mobius syndrome. By recognizing the psychological and cognitive profiles of these individuals, we can better support their mental well-being and academic achievements. Lastly, we have emphasized the importance of a collaborative approach among healthcare professionals in providing holistic care to optimize the quality of life for individuals living with Mobius syndrome. As we conclude, let us reflect on the progress made thus far and remain hopeful for the future advancements that will further enhance our understanding, diagnosis, and treatment of Mobius syndrome. Thank you for your attention, and I encourage you to continue exploring this fascinating field.